Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting into our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, videos, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I like to go through my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, right? So, any of the questions that you see here, I have created based on the current guidelines that are being tested currently on the ANCC as well as AAMP exam. Now, any of the videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. I wanted to throw this in as we are having a practice question course. I will be teaching on July 13th from 10 a.m. to 11:30 a.m. Eastern Standard Time. You've reached out, you asked me. I get a lot of feedback and comments from doing these practice questions. I used to do a practice question course in the past to try to help you guys. But with these videos, y'all have reached out. And the main thing that I find, even with the sessions, are that when you have been unsuccessful on boards, it's not always that knowledge gap, and we know this. But those of you who reach out to me and are so close to passing, the thing is that gap. It's not that you don't know the knowledge; it's that small gap from your knowledge to the application. And I find that when you are reviewing or when you're looking at questions, you're reading the scenario and you're jumping to this answer that you think that they're looking for because that's the way you studied. For example, like that, hey, I want to treat my pneumonia with the macrolide. So as soon as you see this, you think that's the direction that they're going when they may have been asking about somebody with DRSP or whatever else, and you missed the age variance or the level of severity and the curve 65. You know what I mean? You're missing those fine little pieces that should have shifted you. And it's not that you're not correct and you don't know it. It's that you're not paying attention to the specific details. And I spend a lot of time with this just to try to help you learn how to fill that gap, to just flip that light bulb so that you're not going through or grazing through or skimming through and missing the direction that you actually should be taking and going through for the answer choices. So in this practice question course, what we'll do, I'm going to go through the exam breakdown on all of the exam types with you for the ANCC as well as AAMP. I always stress that you should make sure you know what the test is offering. Even when we have talked about this and you heard it, or some of your friends or classmates may have mentioned it, still take the time to know it for yourself. So I will go through all of that with you. We will work through some practice questions so you can see what I'm saying and get a system and apply it. We will work through how to to gauge and work through the different question types, because some are multiple choice. ANCC has a variety of question styles, so we'll talk about those. The select the best two, select the best three, etc., and then some test taking tips. Okay, so we will have all these things. You will have the information to take along with you as well. But I just wanted to do this again to kind of help you tie it all together in hopes of helping more of you guys, because this is the struggle that I'm seeing when I'm being reached out to. It's like, hey, no, you know this stuff. And it's just that gap. You just need to know how to apply it. So if you're interested, the link will be in the description of the video, and I look forward to working with you guys. But with that being said, let's get into our questions for today. All right, question number one states, a patient presents to the office with complaints of frequent headaches with pain mainly over her right eye. She states that light intensifies the pain and she begins to feel nauseated. Based on this presentation, what is the best diagnosis by the nurse practitioner? Is it A, a cluster headache, B, a tension headache, C, a migraine with an aura, or D, a migraine without an aura? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first, right? Because this allows you to slow down and to ensure that you're answering what is even being asked here. So the stem of the question here states, based on this presentation, what is the best diagnosis by the nurse practitioner? So, when we're looking for a diagnosis, I always recommend running it back and seeing what the assessment findings are so that we can come up with a diagnosis or a differential diagnosis, right? So, here the patient comes in complaining of frequent headaches, pain mainly over that right eye, states that light intensifies the pain, and she begins to feel nauseated. So, what is the best diagnosis? So, is it a cluster headache? No. Um, Although cluster headaches can have uh, unilateral pain, it's typically not over the right eye, or over an eye is more like their eye hurts and it's a crushing, severe, sharp stabbing pain, I should say, and so intense that, they say people say it's so unbearable. Like, this is the most severe thing that they will come in and complain about. It's like if they're giving you a description or scenario to talk about cluster headaches, remember they're asking you things on an entry level to make sure that you know the common things and principles. So when they're asking you stuff like this, if they're classic identifiers, be sure they're going to include that, because that's what you should know on an entry level, right? So with that cluster headache, that the thing is that severity of that eye pain is so excruciating they can't take it. It's stabbing, that's cluster. Tension headache is band like, and migraine headaches are the ones that are unilateral, over, like, mainly over the right side. That's unilateral, right? Um, they're having the nausea, light intensified. That's the photophobia. Photophobia, and so that lets you know that this is C, a migraine with an aura. Okay, so C is your best answer. Question number 2. The nurse practitioner has diagnosed the patient with a migraine with an aura. What is the best abortive therapy for the patient at this time? Is it A, sumatriptan, B, propranolol, C, Elavil, or D, Depakote? Take a moment and tell me what you got in the comments, you guys. All right, stem the question here states, what is the best abortive therapy for the patient at this time? Um, So what are we talking about here? We're talking about treatment. We always look to see if they have provided us with a diagnosis. And if not, you need to run it back a step further and see what the assessment findings are so that we can come up with a diagnosis to be able to come up with the treatment, right? So here, the patient has been diagnosed with a migraine with an aura. So we're looking for the treatment for that. But pay close attention. This is why I tell y'all to read the stem of the question. We're not just looking for any treatment. We're looking for abortive therapy, right? So with migraines, our triptans are first line therapy for abortive therapy for migraines, right? So A would be your best answer. But if it said prophylactic therapy, it would have been either B, C, or D. Those are some of the prophylactic management options. So, I always stress this, and you're probably rolling your eyes like, Brittany, duh, we know this. But when you're under pressure, you're reading quickly, don't just jump and say, oh, triptan, and they're asking you about prophylactic therapy. Pay attention to what's being asked. All right, and lastly, question number 3, the nurse practitioner and NP student are discussing contraindications of triptans. All of the following are contraindications of triptans, except, is it A, children under the age of 12, B, hypertension, C, children under the age of 10, or D, an allergy to triptans? Take a moment and tell me what you got, you guys. All right, so stem of the question here states, all of the following are contraindications of triptans, except. So, all right, all we're talking about is contraindication of triptans. Here, the stem states exactly what you need to know for the question, right? And it's asking us, all of the following are contraindications of triptans, except. So we're looking for the incorrect answer, right? So A, children under the age of 12. That's correct. Um, B, hypertension. That's correct. C, children under the age of 10, although that falls into that gap, that's not the range that we look into. So C is incorrect. The best, because it should be under 12, so not just under 10. And D, allergy to triptans. Of course, if we're allergic to it, it's a contraindication. So hypertension is also a contraindication of triptans, but I also want you to think about it. Cardiovascular disease is. So that's CAD, hypertension, history of stroke, all of those things are contraindication for triptans. Children under the age of 12, contraindication of triptans, and an allergy to triptans. All three of those are contraindications. So C is the best answer here. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But you make sure you meet me back here. If you need any of the resources that I offer, feel free to reach out to us at 803 400 6864 or shoot a text message to that number. Or you can shoot us an email at thenursingstudio, the number one, at gmail.com. Things that I offer are the review book, which is an ebook option or the paperback, and they're both linked in the bio of this channel. I offer a self-paced review course for family and adult general, also linked in the bio. We have 5-week reviews, non-clinical reviews, and we also have our one-on-one sessions that are broken down in 3 different tiers. If you're looking to cover just like 1 or 2 weaknesses, that's an option. If you're looking to assess your exam readiness, that's an option. And if you're looking to go from unsuccessful to successful with our custom package, that's an option. I always say with our one-on-one sessions, make sure you reach out to us so that we can gauge, because it's so customized. So let's gauge what you truly need and we'll get you set up with everything. But make sure you meet me back here. Happy studying. Bye, y'all.